Stand by.
Welcome back to Upper Michigan Today, everybody. We are focusing on February Heart Health Month here at Bellin Health Marquette. We are behind the nurses station here in the cardiology department. So if you are a new patient looking to be informed about your heart health, the first doctor you will see is Dr. Chammy here. So, doctor, what can people expect when they visit you for the first time here at Bellin Health?
I'm gonna leave it to Christy.
Okay, we're gonna go over to nurse practitioner Christy Helpinainen.
So patients are referred usually from their primary care provider or another provider, or also some can be self-referred depending on what their insurance is. So they will come, it's usually an hour appointment or more. They'll have an EKG, and then subsequent testing depending on what their diagnosis is, such as an echocardiogram, which is an ultrasound of the heart. Some people need stress testing, which cardiac stress testing, usually it's nuclear medicine that shows if there's lack of blood flow to the heart muscle, and maybe a heart monitor to wear to watch their heart rate and rhythm. They'll have their blood pressure checked. If they haven't had a lipid panel checking their cholesterol levels, those will be done, or even kidney function tests. We will check all those things too.
Does there become a point where you've done the tests and perhaps they need more care than what you're able to provide here, and what does that process look like?
It depends on their diagnosis. If it's very severe, some people are referred to a larger, more specialty center for certain types of heart ailments that they have. But here in the office, yes, we can just do minimal things and see them as an outpatient and then refer to a bigger center if needed. Yeah.
And what bigger centers do you work with? Where might they go from here?
It depends on what their diagnosis is. Bellin and Green Bay, they can be seen down there for quite a few issues such as valvular heart disease, surgical intervention such as bypass surgery, valve surgery, carotids, and transcatheter aortic valve replacements. Otherwise, specialty clinics with like amyloidosis, some people have to go to Mayo Clinic or University of Michigan, depending on where they would prefer to go.
Sure, sure.
So sometimes you might have to be referred to other health clinics, but when you are here at Bellin Health Marquette, who can you expect to see? Who's on the team, and how many patients do they typically see?
Dr. Chammy's here, and then myself and another nurse practitioner primarily. We have seen over 6,000 visits since we've opened in September 2022, and we have about like 1,000 patients.
And where are you seeing patients from? Primarily in the central UP, or are you covering the entire Upper Peninsula?
The entire Upper Peninsula is what we usually see. Yeah, so.
And actually, I might add that many patients also may, by choice or by insurance, want to be treated in this area at, at the hospital Marquette General, and the patient have the option to choose or to stay based on their insurance or their choice practicality where they want to be treated.
Do you ever see patients from outside of the Upper Peninsula?
Actually, we have seen patients from Wisconsin actually come in, very few, but most of the patients are patients local to the Upper Peninsula.
So I think sometimes there's this mindset that we don't have this level of care right here in the Upper Peninsula, that we have to search it out, we have to seek it out, we have to go travel long distances. But you're here, and you're obviously very proud of the care that you're giving.
Mm-hmm. Yes, and even if patients do have to go to a bigger center, they usually prefer that they have a local cardiology team that can help manage things. Our electronic medical records that we have talk to the other electronic medical records, so we can message each other and keep that care proper for the patient.
Do you work with the other physicians and the other medical staff in some of the other Bellin Health areas? So is it sort of like, hey, I have this patient and I have this situation that I want another opinion on. Are you able to kind of share that and collaborate in that way?
Yes. It's so in our own network in Bellin, we can just message each other through the electronic medical record. Outside of that, you still can make a phone call.
Yeah.
It's always trying to take care of what is best for the patient is what we focus on.
Sure.
If somebody's never visited a cardiology department in a medical center before, what are some reasons that they might make a visit to a doctor? Are there any signs or symptoms that you think should be brought up to your doctor?
If they're having, they're a younger person and they have a huge family history of coronary artery disease, especially in men in their 50s, and you're a gentleman in your 40s, and you smoke and maybe drink a little bit too much and don't exercise and a little overweight, you know, you need to get in with a primary care provider at least to begin with and get, you know, your blood pressure checked, cholesterol levels, you know, diet, make sure you're not diabetic. And then, you know, proceed from there. If you're certainly having chest pain, you know, you're short of breath, you're fatigued, you know, there's certain symptoms that you want to look for.
And I'm going to ask this again and probably several times this morning, but you know, there's that idea of being proactive versus reactive. So how often are you seeing people before these symptoms start and are able to work with them before they even get to that stage of fatigue and chest pain? And how do you encourage and how do you get people to think of it before it becomes a much more serious situation?
Usually we're seeing them when they're having some kind of problem, to be honest. But usually they have a primary care provider who is looking for those symptoms and trying to, you know, doing all the screening tests and everything for them. Even primary cares can order an echo. They can order heart monitors if people are having palpitations. So, you know, but usually we see them when they're having some kind of issue.
There's also
But
that.
actually, we have some patients
Yeah.
who ended up, because of concern, having a CT scan, a coro scan, you know, for calcification, and actually the scan is abnormal. The patient have no symptom, and the patient chose to have a scan simply out of health concern. And this is where we see some of the patient. I have to say it's not very frequent here.
Yeah.
Oftentimes we see the patient after they have some symptoms, be it chest pain, be it shortness of breath, or high blood pressure, or so on.
I think it's so common to feel something, to have some kind of condition. You know, you're feeling fatigued, you're feeling some interesting pain that maybe you don't know how to describe it even, and you just chalk it up to some other reason. Oh, I ate a burger last night, it's not settling well.
Oh, I haven't
Or-
been sleeping well.
Exactly.
Right.
I mean, we're always so quick to kind of push things off, but we're learning today just the importance of knowing the difference, paying attention, being honest with not just yourself, but then your doctor, because that's also very hard to be honest and to say, you know what, I'm not the healthiest person. I make bad choices on a day-to-day basis.
And I mean, they're not there to judge you. They're there to help you.
Exactly.
At the end of the day.
And they can't do it without that kind of information. So good. It's incredible the work that you guys do here. We're going to dive in even deeper to really look at some of the scans that they do, some of the tests that they do to show you really what it looks like. We have to take another quick break, but we'll do that when we come back.